Good morning, I'm Joe Fryer. Savannah has the day off. Right now on Morning News Now, quarantine cutdown. New guidance for Americans with COVID, but without symptoms. The CDC now shortening the required isolation time from 10 days to 5, even as the fast-spreading Omicron strain sends case numbers skyrocketing from coast to coast. Hospitals struggling to keep up with the surge. Now the military is stepping in to help. Plus, new concerns over an uptick in cases among children. We have team coverage on all these new developments this morning, including a doctor's perspective with what you need to know to stay safe. Stranded, it's turning into the nightmare after Christmas at airports across the country. The Omicron wave and winter weather causing cancellations and delays, leaving tens of thousands of travelers scrambling to get home. Latest on efforts to get airlines back on track. LAPD under fire. New questions this morning about a police shooting in Los Angeles that killed a 14-year-old girl inside a store dressing room. The body cam video just released by police that shows chaos in the moments before shots were fired. And the power of poetry, a new trend on social media that's actually good for mental health. We'll explain the positive impacts of people sharing their written work in our weekly check-in. Good to have you with us on this Tuesday. We start this morning with new guidance from the CDC for those who test positive for the coronavirus. If you get COVID but do not show symptoms, you only have to isolate for 5 days instead of 10. But you still have to wear a mask around others for another 5 days after that 5-day quarantine. Now, if you're exposed to someone with COVID and you're vaccinated and boosted, you don't need to quarantine, but you should wear a mask for 10 days after that exposure. As for those just trying to figure out if they even have COVID, it's still hard to get tested or find a test. Many people still have to wait in line for hours to get swabbed. President Biden now saying his administration needs to do better meeting the demand.
But it's not enough. It's clearly not enough. If we'd known, we would have gone harder, quicker if we could have. But we have to do more. We have to do better.
More people who are getting tested are ending up with a positive test result. On average, more than 206,000 people are being infected with COVID every day. Growing number of those positive tests are now among children, including those who are still too young to get vaccinated. Dr. Bob Lahita is joining us this morning to help us understand what those who are testing positive need to know about the new CDC guidance. But first, let's go to NBC News correspondent Ellison Barber with Omicron's impact on kids. So, Ellison, the number of kids testing positive is especially high here in Omicron's epicenter, New York City. How is this current surge impacting kids?
Yeah, I mean, when you look at the numbers, we are seeing a rise in pediatric hospitalizations and COVID positive tests across New York State, but specifically in New York City. The numbers this last week compared to 3 weeks ago, pediatric hospitalizations because of COVID-19 are up 395%. And a lot of those children are under the age of 5, which means that they're not eligible to be vaccinated. Now, one of the questions we have when looking at these numbers and this, what seems to be a very startling increase in the number of pediatric cases is one thing that we're trying to get some more information from the New York Department of Health on is how those numbers really break down. What are the numbers specifically for children hospitalized solely because they have COVID-19? What numbers do you have for people who were tested as a part of a hospital's procedure when they came into the emergency room for, say, a broken bone? And then finally, what category of children are there because of that post-multi-inflammatory syndrome in children, MIS-C, which typically appears after someone contracted COVID-19, a child 4 to 6 weeks later. Speaking with doctors here in New York City, they say they are specifically seeing a rise in children hospitalized because of COVID-19 specifically and not any of the others. Listen.
97% of the hospitalizations are in children that are not vaccinated with acute COVID illness. So if a parent wants to do right by their child and prevent their child from getting very sick from COVID, they need to vaccinate their child. And they need to vaccinate everyone in the home because most transmissions happen in the home.
And of course, whenever there is an increase in community spread, children who at this point tend to be more among the unvaccinated groups and obviously a little bit more vulnerable because of that, we tend to see their numbers rise as well. But one thing worth noting here is that this is concerning enough to the New York Department of Health that they put an alert out on Christmas Eve, warning parents, saying that this is, in their words, a striking increase and urging parents to get their children vaccinated while they're on winter break. Joe?
Ellison, just yesterday, New York City's new vaccine mandate went into effect, and that means kids 5 and up also have to show proof of 1 vaccine dose to get into a restaurant or an indoor venue. How are vaccines going among children?
Yeah, in New York, officials, health officials, public officials, they want to see the numbers a lot higher. A little over 50%, 53.8% of children living in New York between the ages of 5 and 17 have gotten at least 1 dose of a COVID-19 vaccine. 41% are fully vaccinated. So that number, from speaking with public officials, they will tell you that that number is not nearly as high as they would like it to be. Obviously, we see in adults in New York much higher numbers, and they, in New York at least, and in other states, they want to see the numbers in children match a little more closely to what we're seeing in adults, especially at this point in time. Joe?
And Ellison, it's not just New York. What are doctors seeing nationwide when it comes to COVID cases among kids?
Yeah, a doctor in Chicago talked about what they are seeing there. And the answer is a lot of similar things. New York is obviously the epicenter, but other states are looking here to see what's happening now because they worry that they could be in the same place, particularly when it comes to children in the coming weeks. Listen to some of what we've heard.
The kids who we are seeing in the intensive care unit with significant respiratory problems because of COVID infection are adolescents who are unvaccinated. Many of them are obese or overweight, and they're behaving a little bit more like adults with COVID.
You know, Joe, covering this for months on end now, I did reporting a few months ago in Mississippi where they were seeing a particularly concerning increase in children hospitalized because of COVID-19. And some of the response from some people in the community and just people watching would be that, yeah, well, the numbers of children hospitalized because of COVID-19 or the numbers of children dying because of COVID-19, it's not nearly what we're seeing in adults. And the answer I heard from doctors working in pediatric wards at other hospitals, they said, yes, but the vast majority of these deaths and severe illnesses in children are now preventable because we have a vaccine. And in their view, if you can prevent even 1 child from going to the hospital, they say, why wouldn't you do it? Joe?
Important perspective there. All right, Ellison, thanks so much for kicking us off this morning. Let's bring in Dr. Bob Lahita. He's a professor at the Hackensack Meridian School of Medicine, director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health. Doctor, good morning. So what do you think is behind what we're seeing in this surge of hospitalizations among kids? Is this because of Omicron?
I think it's because of Omicron, Joe, because, we know that Omicron is very sticky and that it infects so readily. And, it's like a radioactive substance. Once you come into contact with it, if you're in a room and somebody's infected, you're darn well going to get infected. And you can be sure of that. And so that's what we're seeing with kids. The kids and families, et cetera. I feel for the children below the age of 5, but those above 5 should be vaccinated. There's no excuse for not taking care of your children. So that is a very important fact, and that's why we're seeing a 31% jump in kids coming into the hospital. And of course, Joe, obesity and other conditions like asthma and diabetes figure into this equation.
Let's talk about the big headline from yesterday, which is the new CDC guidance for isolation period. So if you're not showing symptoms, your quarantine time now cut in half to 5 days. What do you make of the CDC's decision here? And when are people who test positive still contagious? What are we learning about that?
Well, the important thing to understand is that the shortage of airline pilots, EMS workers, fire, police, school teachers, doctors, and nurses are the reason for this backup. If you test positive and you don't have symptoms, you only have to quarantine for 5 days. But you should wear a mask for an additional 5 days. Most of the infections that occur are 2 to 3 days after you develop symptoms. And that is an important fact to understand. You have to wear a mask when you're around people for at least 5 days after you have been infected and become asymptomatic. And you should also get a test before gathering. And that's important, Joe, for the New Year's Eve parties and the New Year's Eve celebrations, if there are going to be any. And a lot of people are canceling their New Year's Eve plans. You should test negative before you take or before you go to one of these parties or events, so you don't spread the Omicron.
Yeah, in the coming days, I think we're going to be asking you and all our doctors for advice on how you're supposed to have those parties, if at all. I want to also ask you about new research from South Africa that shows an Omicron infection makes people more immune against the Delta variant. Do we know why that's the case and what it could mean for protection against future variants?
Well, this is good news in a way, and it's kind of unusual in a way, because if you're positive for Omicron, it seems that there is a 14-fold increase in immunity for the Omicron variant. And studies in a small group from South Africa, roughly about 35 patients, show that there's a 4.4 fold increase in immunity for the Delta variant, which is what we kind of expected. You know, this Omicron variant being very sticky and infecting so many people now, you would say, well, there's got to be some benefit to it, if anything. And the benefit is apparently it provides you with additional immunity against the Delta variant, which, as you know, Joe, is the very deadly variant that we dread to see. And that's what kills people and puts people in the ICU.
Dr. Lahita, because of Omicron, we are seeing a rise in breakthrough cases. So how do you explain to someone who's unvaccinated, who's looking at this and saying, well, hey, vaccinated people are getting COVID. How do you convince them it's still worth getting the vaccine? Then it's worth getting the booster, even if that means they do test positive at some point?
Well, testing positive doesn't mean that you're going to wind up in the ICU, especially if you're vaccinated and you've had the boost. And I hear this from people all the time. The vaccine hesitant say to me, well, I'm not getting vaccinated. What's the point? You get infected whether you are or you aren't. Yes, that is the case, but you are going to be very, very sick. You're going to wind up possibly on a ventilator or dead if you don't get vaccinated and you don't get the boost. We know that the boost is very effective against the Omicron variant, and we have buried in those Omicron infections are people who are still out there with the Delta variant, and the Delta is very deadly. The Omicron less so, but we're seeing more and more people infected. So we're not so sure that the Omicron is somewhat harmless, as people would like to say. It's not harmless. It's deadly unto itself, particularly if you have comorbidities or you're on chemotherapy or you have an autoimmune disease. You've really got to be careful. So the vaccine hesitancy crowd, and I mean, there are a lot of them out there, roughly, 40 million people. This is not logic. You need to be vaccinated and get your booster to protect yourself and members of your family, particularly children, Joe.
Listen to Dr. Bob, always. All right, Dr. Bob Lahita, thanks so much. Appreciate it. Now, COVID is sidelining healthcare workers across the country, so the U.S. military sending reinforcements to hospitals nationwide to help with staff shortages. NBC News correspondent Shaquille Brewster reports from outside one of those hospitals in Indianapolis.
Hello and good morning, Joe. Well, yesterday we heard from President Biden emphasize and talk with governors about the support that he's providing for states. And Indiana is one of those states receiving the support. The U.S. military sending a team of about 20 doctors, nurses, medical technicians to the hospital system that you see behind me, helping in this crunch. You know, we heard from doctors last week talk about them being in a dire situation, talking about patients ending up in conference rooms at some periods. This hospital system dealing with a 120% capacity right now, which means patients are being sent to locations that they frankly should not be if you listen to what the doctors say. And that's why the U.S. military is coming in. These are medically trained professionals coming in to support much of the hospital staff that we already talk about burnout. We talk about the staffing shortages. This hospital feeling that as well. And look, it is not just the state of Indiana. We're seeing more than 530 members of the military military deployed across the country in some 15 states. Those deployments extending even later this week when a new team arrives in the state of Wisconsin. So this is more federal support for those states in those hospital systems feeling as if they need it more than ever. One other thing that we're focused on here in Indiana is the idea that this is not like what you're seeing in New York, in Florida. They're not breaking case records in the way that those states are doing at this point. But despite that, you hear hospital systems and so many people in the area warning that it could get to that point, and that doctors fearing that because there's a larger unvaccinated population here, fearing that that surge that you're seeing in other areas of the country is only days or potentially weeks away from reaching this state. Until then, they're getting that support. This is going to be a 30-day deployment for the 20 members of the military working in this hospital. Again, not just Indiana, but you're seeing this federal support really accelerate in advance all across the country. President Biden saying he plans to send about 1,000 members of the military to hospital systems all across the country. Joe?
Jack, thank you. Turning now to some breaking news overnight from Denver, where 4 people were killed and 3 others were injured in a series of shootings. Around 5 o'clock local time, police say a gunman opened fire near a tattoo shop in downtown Denver, killing 2 women and wounding 1 man. After law enforcement identified the suspect's vehicle, the gunman fled into the nearby suburb of Lakewood, where police say he killed 1 more person before he was shot and killed by officers. Overnight, Denver's police chief commented on the string of shootings.
This is the holiday season. To have this type of spree take place is not normal for our community. I also want to commend both the Lakewood Police Department and the Denver Police Department for putting themselves in harm's way to bring this person in custody or to stop this spree from continuing.
1 Lakewood police officer was injured in the shooting and was undergoing surgery overnight. Police also said no motive has been identified. The investigation is ongoing. Also breaking overnight, a plane crash left a trail of destruction in a Southern California neighborhood. Authorities say the Learjet was bound for an airport just a few miles away outside San Diego when it crashed. It's unclear how many people were on board, but no one survived. Medical examiners are still working to identify the victims and notify their families. The crash damaged a home and several power lines, knocking out power to more than 2,500 residents. Incredibly, no one on the ground was hurt. Holiday travel chaos is still unfolding at airports all around the country. Delays and cancellations are mounting. You can blame a combination of bad weather and airlines struggling to fill the openings in their staff caused by the spread of the Omicron variant. NBC News correspondent Sam Brock has the latest from Miami.
Joe, good morning. As you look at all the activity behind me, there have already been more than 680 flight cancellations domestically today and more than 500 delays. That's on the heels of 1,400 plus cancellations yesterday and 7,700 delays. Flight experts say things should be getting a little bit better in the next couple of days, but then New Year's is a challenge.
It's a brutal 1-2 punch of COVID and winter weather, igniting widespread cancellations and flight delays. Both passengers and crews slowed by the rapid spread of Omicron.
About 4 o'clock in the morning and got to the airport, got on the plane, everything was fine, and then one of the pilots didn't show up. So we had to deplane.
United Airlines says roughly 1 out of every 30 of its flights was canceled Monday. And widespread delays meant fewer than half of all passengers made it to their destination within 4 hours of the expected arrival time. For Delta, weather snarling traffic at key hubs like Minneapolis, Salt Lake City, and Seattle.
It was a pretty tough night. I spent about close to 12 hours in the San Francisco airport.
One Delta flight from Tampa to Atlanta had to deal with potentially criminal behavior. In a sign of the times, a woman berated a man for not wearing his mask while not wearing her mask.
As soon as we get Atlanta, you're going to jail.
It devolved into spitting, punching, and scratching, that woman then appearing in a federal courthouse Monday. Delta saying in part the company has zero tolerance for unruly behavior at our airports and aboard our aircraft. Meanwhile, Airlines for America and several airline CEOs supporting the shorter quarantine time just issued by the CDC for sick crew members. But the Flight Attendants Association has deep concerns.
10 days may not be right for every single case, but it's certainly going to be more right than 5 days would be, where we know that some people would be forced to come back to work while they're still sick.
To create a safer environment for everyone, Dr. Anthony Fauci suggesting it might be time to require a vaccination to fly.
If you want to do that with domestic flights, I think that's something that seriously should be considered.
Dr. Fauci did clarify with Kristen Welker last night that he has not recommended a mandatory vaccination policy for anyone flying to the president. He says there's no decision coming in the foreseeable future. Joe, it's also notable that the U.S. Travel Association has voiced its opposition to that policy months ago. Back to you.
Sam Brock, thank you. That winter weather out west isn't just causing problems for air travel. It's also a headache for drivers on the roads, though it's also bringing some much needed relief to ski resorts. The extreme winter weather is battering areas from Washington to Northern California, and the Midwest could be in for a similar winter blast in the coming days. NBC News correspondent Steve Patterson has more on the travel outlook.
Hey, Joe, good morning. It is no doubt a winter wonderland here, but to those that live in regions that aren't used to this weather, the blustering snow, the brutal cold, experts are advising those people in high-risk areas to just stay inside and stay safe.
This morning, a powerful blast of winter. From coast to coast, over 30 million Americans under winter weather alerts. Storms and snow already blanketing the West, expected in the Northeast and Midwest in the next 2 days.
In Northern California, whiteout conditions causing chaos.
It was so bad that it would be basically impossible to get from one exit to another.
Miles of interstate highways shut down, roadways coated in ice and snow.
Well, I'm stuck over here.
Snowpack in the Sierras shattering December records.
This is the most snow we've had in at least in 12 years.
So much snow fell at some Lake Tahoe ski resorts, they had to shut down the slopes. The conditions considered unsafe.
We're happy there's snow, but then again, there's no business.
The Pacific Northwest already blanketed in snow, with more to come. In Seattle, frigid temperatures sending a chill through the region, the coldest in years.
Hopefully it's not around too long.
Parts of Oregon getting pummeled. The governor declaring a state of emergency through the new year.
Too many people that don't know how to drive in the snow.
In the Midwest, blizzard conditions blasting the region, from Minnesota to the Dakotas. In Fargo, near zero visibility as the region braces for bitter cold. Wind chills as low as 50 below zero. Now in the forecast, authorities warn the safest way to ride out the year-end winter weather blitz is to avoid it altogether.
Stay home and enjoy the holiday.
And here in Big Bear, a winter storm warning just expired, leaving nothing but fresh powder on the ground. Great news for those ski resorts in the area, but the roads are still very dangerous as the system now moves east. Joe, back to you.
50 below wind chill. My goodness. Steve Patterson, thanks so much. With that, let's get a check on your morning news now. Weather, Michelle Grossman is with us. Michelle, good morning.
Good morning, Joe. I know it sounds so weird to say. It sounds so weird to say 10 feet of snow, too. I have to check myself a million times. But yeah, that's what we're looking at. Extreme cold. We're also looking at extreme warmth today. Let's, though, start with the snow because we are looking at snow falling today. We could see a foot of snow in some spots. I mean, it really is pretty to look at. But if you're in it in Fargo, North Dakota, you are dealing with lots of snow. You're also dealing with those cold temperatures, wind chills, gusty winds gusting over 50 miles per hour in parts of the west and the northern plains. Otherwise, we're looking at alerts coast to coast from the west all the way to the northern plains, the Midwest, the Great Lakes into the Northeast. 25 million people impacted with that persistent snow across the west. And we're looking at slick conditions in the Northeast. So this is what the setup looks like. Heavy snow and strong winds in the Four Corners, winds gusting over 50 miles per hour. And then tomorrow, you guessed it, another storm moving down the coast. We could see some heavy rain in parts of Southern California. So localized amounts of snow up to a foot of snow. It seems like nothing compared to the 10 feet that some people received in the highest elevations of the mountains, but still a lot of snow, and also up to 2 inches of rain in parts of Los Angeles County. Again, we could see some flooding and some localized flooding in the burn areas. Frigid morning for many, Joe. Again, wind chills as low as 45 below zero. Meanwhile, in the south, we're looking at temperatures in the upper 70s and low 80s for some.
We're back with a mother-daughter shopping trip in Los Angeles that ended in tragedy. The police were responding to a call of an assault in a store when an officer's stray bullet hit a teen girl unseen in a nearby fitting room. NBC News Now correspondent Priscilla Thompson joins us now with the latest on this. Priscilla, good morning.
Joe, good morning. This incident occurred just days before Christmas, and now the LAPD is releasing 911 calls, body camera footage, and surveillance video that show new details about how this deadly event unfolded. The death of a 14-year-old girl shot and killed by the Los Angeles police has been ruled a homicide.
He's hitting behind to the right, where the fitting rooms.
Newly released video shows the moments just before police say they accidentally shot the teen.
Victim down! Victim down!
The LAPD edited and released the body camera footage, surveillance video, and 911 calls just days after the deadly shooting at a Burlington store in North Hollywood. Police say they were responding to an assault with a deadly weapon and possible shooting. The victim, identified as Valentina Oriana Peralta, was reportedly trying on dresses for a quinceañera. At the same time, police say they were shooting at the suspect in the earlier assault as he stood in front of a wall. Investigators say the 14-year-old and her mother were behind that wall, unbeknownst to officers.
We were able to locate a 14-year-old female who was found deceased in that dressing room.
The teen was killed by a gunshot wound to the chest, according to the medical examiner.
Preliminarily, we believe that round was an officer's round.
The suspect in the alleged assault that prompted the shooting, 24-year-old Daniel Lopez, was also killed. LAPD Chief Michael Moore saying in a statement that he is profoundly sorry and, quote, "This chaotic incident resulting in the death of an innocent child is tragic and devastating for everyone involved." The apology comes as the department faces scrutiny for firing multiple rounds in a crowded store. Law enforcement experts say it's too early to know exactly what went wrong. What is the protocol when police are pursuing a suspect who may be armed in a crowded place like a store?
You, being the law enforcement official, have a responsibility to be sure you keep everyone safe. You want to be able to place your shot in the right place, but unfortunately that may not always happen. And that's what makes this very sad and tragic.
The deadly incident is currently under investigation by both the Los Angeles Police and the California Department of Justice. And Joe, a determination of homicide by the medical examiner does not necessarily mean that someone is going to jail. There are going to be a number of other things law enforcement experts tell me that investigators are going to be looking into here, including intent and sort of if there were any violations of training or protocol in this incident. Joe?
Priscilla Thompson, what a tragedy. Thanks so much, Priscilla. With the Beijing Winter Olympics just about a month away now and coronavirus surging globally, the Chinese city of Xi'an is entering its 6th day under lockdown. Authorities there reported 150 new symptomatic COVID cases, the country's highest since the early days of the pandemic. NBC News foreign correspondent Molly Hunter has been following this story for us. Molly, good morning. So what do we know about this COVID outbreak in Xi'an and the lockdown that they have in place now?
Hey, Joe, that's right. So as you mentioned, these are the highest numbers that we have seen in China since March 2020. And as you mentioned, 150 over the weekend. The cases yesterday, 162. That is minuscule compared to, of course, what we're seeing here in the UK, what you guys are seeing in the US. But this is the 6th day of lockdown. It is a city of 13 million people. Joe, they've even put 30,000 people in hotel quarantine. And today they launched the 5th round of mass testing. So we should get more accurate numbers if they share them later today.
And Molly, the Olympics are set to begin on February 4th. Thousands of athletes and officials are going to be traveling to China in the days and weeks leading up to that. Any sign this outbreak or the lockdown could have an impact on the games?
Right. That is the worst fear. We're just a few weeks away, of course. And we have to remember that China has been pursuing what they call a zero COVID strategy, not what the U.S., what the UK, what other European countries are doing, which is figure out a way how to live with this. But it's worst case scenario for China if they are not able to put on the games. The IOC, last time they were asked about it, said they are going to go ahead. Joe, for athletes, for journalists, for anyone flying in, there will be very strict restrictions, a closed loop policy, it's called. So you won't actually have any contact with people who actually live there if it all goes according to plan. There will also be daily PCR testing. But Joe, given how transmissible Omicron is, and the Beijing government hasn't told us how many of these new cases are Omicron, you got to think that even more restrictions might have to go into place. Joe?
Yeah, likely another unconventional Olympics ahead. Molly, thank you so much. Let's take a look at what else is making news around the world this morning. NBC's Raph Sanchez joins us from Tel Aviv. Raph, good morning.
Joe, good morning. The Brits have the green light to go ahead with New Year's Eve parties. The UK government says it will not introduce any new COVID restrictions in England before the new year, despite a record rise in case numbers. The health secretary is urging people to take a test before going out and to stay cautious while partying. In Myanmar, the UN is calling for an investigation into reports of a massacre on Christmas Eve. Government forces allegedly killed 35 people in a village in the east of the country. 2 aid workers from Save the Children are missing in the attack. The U.S. Embassy called the assault barbaric. And finally to Colombia and the rare case of an albino jaguarundi cub. I didn't know this. A jaguarundi is a kind of small puma. It's actually not that much bigger than a house cat. And this albino cub had to be rescued because it would struggle to survive in the wild. Joe, one of the problems it faces, because it's white, it can't camouflage in the jungle. Joe.
New Year's Eve in Times Square may not be a return to business as usual, but the ball drop will be back and better than ever. This year's Crystal Ball will feature 192 Waterford crystals, more than 32,000 LED lights. Workers installed the last of the crystals yesterday, but the finishing touches on the ball ahead of Friday night. The celebration will be scaled back this year because of the spread of the Omicron variant in New York City. As things currently stand, that means an audience almost 4 times smaller than pre-pandemic times. But the musical guests will still be out in force, including Grammy-nominated singer KT Tunstall, who's set to headline, joined by LL Cool J, Chloe, Journey, and Karol G. To another big tradition on New Year's, that's bowl games. For the second year in a row, the pandemic is impacting college football. The spike in COVID cases has led to 4 college bowl games being canceled as schools struggle with players dropping out. Joining us is USA Today sports reporter Chris Bumbaka to break down where things stand. Chris, good morning to you. So what's been the NCAA's approach to handling the pandemic this season, especially right now?
Yeah, so the NCAA as a national institution has by and large punted on this issue of the pandemic for a second straight year and really left it up to the conferences and those jurisdictions to decide how they want to test players, vaccine mandates and thresholds and things like that. And really all of those protocols are left up to the conferences because the NCAA has really opted not to offer much leadership on this issue at all since March of 2020.
So what were the factors behind those canceled college bowl games? What ultimately led them to do that?
Yeah, it really comes down to the number of scholarship players available on these rosters. Teams are allowed to have 85 scholarship players, and I think one of the reports I read for the Gator Bowl, which Texas A&M had to drop out of, that was one of the bowl games that was affected but not ultimately canceled. So they were replaced by a 5-7 Rutgers team. So that's what one of the effects is of this pandemic is that you have under 500 teams playing in the postseason now. But one of the reports I read said that they were down to 39 scholarship players. So if you cut that player pool in half, it's really going to be a dangerous situation for the team in terms of depth.
Yeah, and a lot of people are wondering about the national championship. The college football playoff semifinals are scheduled to take place this Friday. Are there contingencies in place if a team isn't able to play? What will they do in that situation?
So it's really a last man standing situation. Unfortunately, what's going to happen is that teams are going to advance based on forfeiture if teams can't go, if their opponents can't go, and then if that happens in the national championship game, or say 3 teams in the next 2 days are unable to field rosters for the semifinals, then the last team left will be declared the national championship. Kind of a crazy time we're living in. College football's 2020 season was really affected by the pandemic. It was able to get through 2021 without too much, drama, I guess, when it comes to the coronavirus. But as we approach bowl season here and Omicron traveling, rising cases, it's been quite the challenge for college football as it tries to re-enter the conversation after a 3-week layoff.
Yeah, that would be a bummer all the way around if the national championship ends up being a forfeit for fans and players and everyone else. So hopefully that's not what happens and those players can stay healthy and we can see those games. All right, Chris, thanks so much. Appreciate it. Time now for your weekly check-in, where we take a closer look at the biggest mental health headlines and how they impact you. Let's bring in Dr. Sue Varma for more. She's a clinical assistant professor of psychiatry at the NYU Langone Medical Center. Always good to have you with us, Dr. Varma. So let's start with the growing mental health crisis among children. The U.S. Surgeon General Doctor had this to say about the pandemic's impact on kids.
We've seen anxiety and depression rates go up among kids. But here's a really important part, Dana. Our kids were struggling long before the pandemic. You know, in the decade before the pandemic, we saw a 40% increase in the number of high school students who said they felt persistent feelings of hopelessness or sadness. We had increases in suicide rates among kids to alarming levels. So our children have been struggling for a while.
Do you agree that this situation needs urgent action, and what needs to happen now to help young people?
Absolutely. We are definitely in the midst of a crisis. There was a crisis already before the pandemic. And what we know is that underlying these feelings of depression, anxiety, helplessness, and hopelessness in young folks is a feeling of loneliness. And we are having the largest epidemic of loneliness, but particularly in younger generations. And we're finding that social media use, even though it can for some people help increase their feelings of connection, it's not the case for a lot of other children and teens. And what we need to do is really increase the surveillance in the primary care setting. So when young people are visiting their pediatrics for a lot of routine visits, we are now seeing depression rating scales, anxiety rating scales, ADHD being included, but it's not the case everywhere. And to ask the pediatrician, perhaps even to book an appointment simply for your mental health. This is not something that a lot of people think of because they're there for their, vaccines or routine visits, height and growth, weight, and they forget to mention some of these issues. And also, I would say, is asking for a referral. Therapy can be so important, and medication, of course, if needed, can go such a long way in improving a person's mental health. We also need to have physical exercise, sleep, connection, outdoor activities as much as possible, because all of this was stripped away along with the connection during the pandemic.
Dr. Varma, let's talk about something that a lot of us do, but we may not have realized that it has a name, and that name is revenge bedtime procrastination. What is that? Explain what it means and how can we fix this habit?
So right around bedtime in the later parts of the evening, the person says instead of winding down, they almost get a second wind of energy and they don't want to go to bed. And one of the things that I see happen all the time, and I can say I'm guilty of this too, is scrolling on your phone. All of a sudden we feel that we need to sort of seize the day and start getting productive. What's happening is that a lot of us are working from home and the lines between work and life have blurred. So people are working longer and harder and into the evening. So there is no separation. We don't have that commute a lot of times. And so we are watching, streaming or looking on our phones. And the two main feelings behind that is a feeling of deprivation. I would say that like not having enough stimulation or excitement, and also a feeling of avoidance, of not wanting the next day to begin. And underlying that is also a feeling of loneliness and wanting connection and trying to find it in some of these places online.
The word revenge does make it sound a little bit scary, but I definitely can relate to that experience, especially with work and home not being separated so much over the last couple of years. Finally, I want to talk about something that social media, we often talk about being harmful, but here's a trend that might actually boost your mental health. Poetry Instagram. It's gaining traction from people posting their written work in the spoken word, bringing joy to people who need a break. Why can poetry have such a positive impact on your mental health?
Words have impact, and words convey emotion. They convey a desire for connection. They can be super uplifting. They can be very inspirational. And a lot of times when we read the poetry, it might be very short, but it hits it right on the head. And you're looking at it and you're like, oh my God, I can totally relate. I feel seen. I feel validated. And literally in, less than 20 seconds, you feel an immediate connection to the person who's writing it. You want to share it with other people. You might end up sharing it with other people online. The way humor means, which is something that I'm doing a lot on my Instagram these days, and I'm sharing it with other people. So the connection part is a really big part of it, that it brings people together and uplifts them at the same time.
U.S. cruise ships are once again dealing with COVID outbreaks among passengers and crew members. That's forcing several ships to return to their port in the middle of their voyages. The outbreaks come despite higher health standards for anyone on board, including proof of vaccination and a negative COVID test. NBC News correspondent Kerry Sanders has more from Port Everglades, Florida.
Well, Joe, thankfully, this is not as it was back in the spring of 2020 when cruise ships were teeming with COVID and passengers were stuck at sea in some cases for weeks on end. But this is not what the cruise ship industry was looking forward to after returning and having mostly COVID-free trips with more than 4 million passengers worldwide.
The cruise ship industry is dealing with a COVID mess once again after multiple ships returned to U.S. ports with outbreaks. The Koningsdam Holland America ship now back in San Diego after getting turned away from Puerto Vallarta, Mexico, because an undisclosed number of crew members tested positive, even though the company says they were fully vaccinated.
They kind of let us know, hey, look, we let the authorities know that there's some people in the crew that are sick.
Lynn Hoffman was on board.
Everybody in the ship wears, masks. Again, this might be one of the safest places because everybody's vaccinated. We were very careful.
Now back in Florida, the Carnival Freedom was turned away from Bonaire and Aruba after an undisclosed number on board tested positive.
I feel like I was just in a petri dish waiting to get COVID.
Ashley Peterson, a passenger on the 8-day cruise, says it was a nightmare.
I didn't feel safe at all. I basically spent most of the time during the day locked in my cabin.
Royal Caribbean International's Odyssey of the Seas only spent 1 day at sea before turning back to Fort Lauderdale after a passenger tested positive. 4 days later, the same ship was turned away from Curacao and Aruba after more than 50 people came down with COVID. These outbreaks happening despite enhanced COVID safety protocols. All 3 cruise lines requiring adult passengers to show proof of vaccination and a negative COVID test while encouraging mask use indoors.
I had no concerns at all. The cleanliness standards were really good. I think they responded really quickly to contain everything.
Not the holiday season the cruise ship industry was hoping for, as they anticipate a busy 2022.
For those who are now maybe rethinking their upcoming voyages, your vacations may actually become costly. You may not get your money back. This is really determined by each cruise line. Some will give you a refund, while others will give you a credit for a future cruise. Joe?
Kerry Sanders, thanks so much. Time now for our CNBC Money Minute, the biggest financial headlines of the day and why they matter to you. Silvana Henao joins us. Good morning, Silvana.
Hey, Joe, good morning. Well, Apple has closed its 12 stores in New York City to indoor shopping as cases of the Omicron variant surge. These include the locations on Fifth Avenue and in Grand Central Station. Apple says customers will still be able to pick up online orders at the stores. Earlier this month, Apple temporarily closed 3 stores in the U.S. and Canada after several employees tested positive for COVID. It's also now requiring all customers and employees to wear masks. Get set to pay even more at the grocery store next year. Many food manufacturers plan to raise prices on a range of items, from coffee to condiments like mustard and mayonnaise. Food prices are forecast to rise 5% in the first half of 2022. Oreo maker Mondelez is hiking prices across its cookies, candy, and other products by 6 to 7%. The Wall Street Journal reports Kraft Heinz will raise prices for Jell-O, Grey Poupon, and other products, with some going up as much as 20%. Although it won't all be passed on to consumers, many staples are expected to be more pricey because of higher labor, packaging, and shipping costs. And maybe the third time's the charm. Motorola is reportedly working on a new version of its Razr foldable smartphone, according to a post spotted on Chinese social media. CNET and The Verge report the new Razr will have improved speed, a more user-friendly interface, and a new design. Motorola revived the Razr in 2019 and updated the model last year. Back to you.
You know, I loved my little red Razr like 14 years ago, but I'm not sure if I want a new one. We'll have to see.
You know, I think I want one. I think I do want one.
All right. Let me know how it is then. Maybe I can be convinced. All right. Whether we had to cancel trips or travel in the middle of a surge, 2021 was certainly a year for ups and downs for the travel industry. So will 2022 bring more of the same, or will we finally be able to plan those big trips many of us have been putting off? Well, here to help break it all down is Morning Consult's travel and hospitality analyst, Lindsay Roschke. Thanks for joining us. It's probably unfair to throw these questions at you because none of us really know what's going to happen now in the next few weeks. But let's start with the situation right now. We're seeing another surge in flight cancellations. That impacts things like hotels, restaurants. So how is the travel industry coping with this turbulence right now?
Yeah, it's been quite a hectic week for the travel industry for sure. I think we're likely going to continue to see some flight cancellations through the rest of the holiday period, although the announced CDC reduction in quarantine time for asymptomatic cases could help to provide some relief for short-staffed airlines and hotels in the coming weeks. So hopefully we'll start to see some of that level out just a little bit. The one thing that I think is important to understand, though, is some of those flight cancellations tend to be more concentrated on international versus domestic. So that's going to continue to be an area of question as we move into the new year, just because there's a lot more uncertainty there in terms of border openings and testing and quarantine requirements as well.
Yeah, that's going to be our big question. We've booked some international travel. It's refundable, but we're waiting to see kind of what happens with that. Now, let's look back here. 2021 was supposed to be the year of the so-called, yes, I'm going to say this, hot vax summer, with travel allegedly returning to normal. As we know, things turned out a little differently. That's when Delta started to spike. What kind of trends can we expect heading into the new year?
Well, you said refundable. That's the name of the game in 2022. I think people are making really calculated choices about what they are willing to book. We're likely going to see people continue to do that. The Omicron variant has been pretty disruptive because of how quickly it spreads, but we have found that traveler comfort levels tend to be fairly unscathed. The people who are taking precautions are taking those precautions and still kind of living life the way that they want to do that. So, the major trend that we're looking at is people looking for flexibility, cancellation policies, and also, planning on shorter timelines, waiting a little bit longer to book those trips until they feel a little bit more comfortable that the situation might have kind of evened out a little bit more. The other thing that I think we're going to see is a continued debate over vaccine mandates for air travel. It was something that was brought up by Dr. Fauci yesterday. We've found in our own research that a majority of Americans support the idea of a vaccine mandate for domestic flights, but that's going to continue to be a hot topic as we go into 2022, especially given everything that's happened, over the holiday season so far.
Has this changed how we plan our vacations? Do we do it differently now? And could this be a permanent change?
Yes, absolutely. Planning on a shorter timeline, as I said, is definitely something that's become more regular for travelers, and also looking for those flexible options. But I think some of the other things that are really going to stick for travelers going into 2022 are looking for options that allow them to stay away from others. The return of the road trip kind of came back during COVID. We expect that to really stick. Car travel feels a little bit less fraught and concerning than plane travel, both from a health perspective and from a logistical perspective. And also, heading out to national parks and areas that allow for some kind of built-in social distancing. Those are the types of trends that have really cemented throughout the last almost 2 years now, and we expect to stick around.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.